All right, so one thing that's becoming very common these days is doctors buying patient records of other doctors who have maybe smaller practices, or maybe their leases are running out and the landlord's not willing to renew their lease. I think it's a great idea. If you can buy someone else's patient records and add it to your patient records, awesome. It's a really good way of increasing your top line revenue without necessarily increasing a lot of the other expenses that come with usually doing that, like paying large sums of money for it. Now, the question really is, how do you buy these patient records? Now, that's where the details really matter, because the way you set up the compensation, or the amount of money that you give, the consideration you give to the seller, is really, really important. So there's a couple of options, right? You could pay them a large chunk of money. If they're making $300,000, $400,000 from those patient records, you could give them a value for that. You could do it as an earn-out, of course, where you pay over a longer period of time based on how well and how many of those patients come to your office. And then there's sort of the different version where you bring them in almost like a space sharing situation, where the seller works and shares your space and pays you rent, and then whenever they decide to retire, then maybe you assimilate those patients into your practice. So there's a lot of ways of skinning the cat. They all have their pros and cons. But what I can tell you is that if you can buy someone's patients and add it to your patients without having to pay a huge amount of money, that is by far the way to go. Now, if you have questions about this, give us a call. We can walk you through all of these things. Just remember, it's a great way of adding top line revenue, but you got to do it the right way so you don't overpay. All right, thanks.